There are more and more direct-to-consumer testing options available in today's market than ever. And one of the most common things we're seeing are patients are coming to us with food sensitivity tests. A lot of times these patients have a lot of digestive issues or have some other symptoms that they think that eliminating certain foods from their diet could help them improve their health. And that's absolutely true. But a lot of times what we're seeing with these patients is that they're eliminating sometimes 20 or 30 different foods, but yet they're still suffering with the same symptoms they had before. And so today, before you order one of these tests, I want to go over with you the 4 things to take in consideration before you order one of these things. The first is what's the purpose of the test? What's it actually testing for? The second is what limitations there are with that test. The third is what symptoms should you have before ordering the test? And lastly is what other testing options you should consider that help you put all these pieces of the puzzle together. So what is the purpose of this food sensitivity test? Well, the most common test on the market today is a test that tests for your IgG immune system response. And the IgG immune response means that it's a delayed response. It takes time for the immune system to recognize the food and to react to the food. And so this test is perfect for people that aren't quite sure what's affecting their health. It's not like you eat the food and you have an immediate pain. It's you eat the food and then you have some type of chronic response to that food after you've consumed it. So it's going to be 24 to 48 hours after you've consumed the food. So that's the first thing to understand. Now, with the testing, there's going to be some limitations. And the first is that it's only testing your IgG immune system. And some of you are familiar or may have heard of when you go to the doctor, they do these pinpricks and they find out what foods that you have allergies to. And those allergies, sometimes what we're finding is people aren't being tested for these things. And those where your body has an immediate reaction to that food. A lot of times an immediate reaction to a food can be that your eyes get watery or that you get some type of flushing or hives. And some people have troubles immediately with congestion or trouble swallowing or troubles breathing. And so those are the immediate reactions that people can have. And so in some cases, you might want to consider getting an IgE test. The second thing to consider in the limitation is that it's not testing for intolerances. A good example of this is that 85% of the African American population actually have a genetic snippet that doesn't allow their body to make the right enzymes to break lactose down. And if they can't break lactose down, they're now lactose intolerant. So if they did a food sensitivity test that looked at IgGs, it wouldn't show up. So here's a group of people that are eating a food that's hurting them, but the IgG test wouldn't show that. Another thing to consider too is that it's not going to look to see if you are able to digest and break down the foods that you're eating. We oftentimes see, and we'll discuss this later, is that people don't have the enzymes, they don't have the right amount of acid to break these foods down, and so of course they're going to have a reaction when they consume those foods. So when should you order a food sensitivity test? The first condition I'd recommend you ordering this test for is if you're suffering from an autoimmune disease. Autoimmune disease is where your immune system starts attacking its own tissues, and based on the tissues it attacks is what you call it. So if it's eczema, psoriasis, lupus, Crohn's, celiac, multiple sclerosis, rheumatoid arthritis, those are when you want to consider running this test, because research has shown us, for example, that if somebody has celiac disease, by eliminating gliadin, which is a protein found in gluten, that by removing that one IgG food sensitivity can actually reverse the disease. And now researchers have taken that one step further and found that by eliminating IgGs, that you can actually get the expression of the immune system. You can get the immune system to calm down by eliminating IgG food sensitivities. The second reason you should consider ordering a food sensitivity test is if you're suffering from chronic inflammation. Now, chronic inflammation can show up a lot of different ways. It can show up as headaches or migraines. It can show up as debilitating fatigue, chronic sinusitis. It can show up as painful menstrual cramps. It can show up as general achiness or feelings of unwellness. And research has shown us that by reducing the amount of IgGs and the amount our body's immune system is responding, that we can lower those inflammation levels and improve many of those symptoms. The third and final reason you should consider running a food sensitivity test is if you're suffering from chronic constipation, diarrhea, or IBS. And research has actually shown that when patients follow a food elimination diet based on their IgG symptoms, that they do better than a group that follows a sham diet. So that's something also to consider. So let's review. We've discussed what's the purpose of the IgG food sensitivity test. what are the limitations, and what symptoms and conditions should you consider ordering it. And finally, we just got to go over what are the things you should take into consideration as well with the food sensitivity test. Because I can tell you from my experience that it's never one item that's in isolation that's causing people's problems. And what we find is it's usually a multitude of different things that can affect somebody's health. Some of those things can be, for example, like we mentioned earlier, that somebody doesn't have enough acid to break their foods down. So by looking at a blood test, we can actually look to see if their chloride levels are low. Chloride helps make up something called hydrochloric acid, which helps you break down those foods. The second thing we can look at is elastase, and we can actually do that in a stool test. And elastase is actually released from your pancreas, and it also helps you break those foods down. So if you're getting bloating, indigestion, there's a good chance that you could have one of those other problems that are contributing. And the next condition you need to be considerate of is a condition called small intestinal bacterial overgrowth. And what we see with these patients is that they have a bacterial overgrowth that's in their small intestines. So within about 30 minutes to an hour after they eat, they start getting distension of their stomach, right at their upper part of their gut. That distension causes a great deal of pain, and it can lead to constipation and diarrhea as well. And the problem is that many of those things that can feed that bacteria are things that we consider healthy. A lot of fibrous foods like fruits and vegetables, even beans or legumes, and even bread or dairy products can cause and feed that bacteria. And so finding out that if you have an infection is critical. And the last thing to consider if you're having digestive issues is to do a stool test. Now the stool test is going to look at the large intestines. And I would say over 90% of the patients that we test have some form of overgrowth of bacteria, a parasite, a worm, or deficiency in the enzymes that help them break those foods down. And once we're able to find out what's causing someone's issues and be specific in our treatments, it's obviously going to afford them better results. And like I said earlier, it's not normally one thing in isolation that's affecting somebody's health. And so it's very important to look at all the different factors that are possible and address all those issues at the same time in order to help a patient get the best results. So with that said, if you've liked today's message, please share it, like it, or comment on it. It encourages us to keep doing this type of work and putting this information out. As well as if you'd like to learn more about digestive issues and how it is that we might be able to help you, click the link somewhere below. And until next time, get well, stay well.